You may have heard a lot about cholesterol and blood pressure when it comes to your heart health. These are important numbers to know. But there is another marker that often flies under the radar. It is called homocysteine. Think of it as a substance that your body produces as part of its normal daily functions. It is a type of amino acid. Your body uses amino acids as building blocks for proteins. In a healthy body, homocysteine levels are kept low. They are quickly converted into other useful substances. But when this process breaks down, problems can begin. Understanding this simple marker could be a key piece of your personal health puzzle. So, why should you care about homocysteine? The primary reason is its connection to the health of your heart and blood vessels. High levels of homocysteine in your blood are considered a risk factor for cardiovascular disease. This is the same category where we place things like smoking, high cholesterol, and a sedentary lifestyle. Research has shown that elevated homocysteine can damage the delicate inner lining of your arteries. To understand how homocysteine can become a problem, it helps to know where it comes from. It is not something you eat directly. Instead, your body produces it as a byproduct of methionine metabolism. Methionine converts to homocysteine and can be recycled back with B vitamins. You get methionine from the protein in your diet: meat, fish, eggs, dairy. When your body breaks down methionine, homocysteine is created as an intermediate step. It's a natural brief stop on a metabolic pathway. Once homocysteine is formed, your body has two main pathways to deal with it. It does not let it linger. The first pathway is called remethylation. In remethylation, your body recycles homocysteine, converting it back into methionine. This recycling process requires cofactors, B vitamins, folate, vitamin B9, vitamin B12. Without enough folate or B12, this recycling pathway slows down considerably. When homocysteine levels rise and stay high, the condition is called hyperhomocysteinemia. This is where the risk to your health truly begins. The primary concern is the damage it can inflict upon your blood vessels. Think of the inside of your arteries as being lined with a very smooth non-stick surface, the endothelium. High homocysteine acts like sandpaper on this surface. It causes tiny injuries and inflammation. This damage makes the artery walls less flexible and more sticky. As a result, it becomes much easier for LDL, the bad cholesterol, and other fatty substances to cling to the artery walls, initiating the process of plaque formation. This buildup of plaque is the hallmark of atherosclerosis, or hardening of the arteries. As these plaques grow, they can narrow the arteries. This reduces blood flow to vital organs. If this happens in the coronary arteries, which supply blood to your heart muscle, it can lead to chest pain or angina, or even a heart attack. If it happens in the arteries leading to your brain, it can cause a stroke. High homocysteine levels are also thought to promote the formation of blood clots. A blood clot can get lodged in a narrowed artery, completely blocking blood flow, and triggering a heart attack or stroke. High homocysteine can also affect the smaller blood vessels throughout your body, contributing to a range of other health issues. There are several reasons why a person's homocysteine levels might become elevated. These causes can be broadly grouped into a few key categories: nutritional deficiencies, genetic factors, underlying health conditions, or lifestyle choices. The most common cause, and fortunately the most correctable, is a deficiency in B vitamins essential for metabolizing homocysteine. A diet low in folate, vitamin B9, low vitamin B12, low vitamin B6. These vitamins are critical cofactors that let your body clear homocysteine from the blood. Genetics can also play a significant role. Some people have a common variation called an MTHFR gene mutation. MTHFR is the enzyme methylene-tetrahydrofolate reductase, crucial for processing folate. That variation can reduce your ability to use folate effectively, which can impair the homocysteine recycling pathway and raise blood levels. But having the variation doesn't automatically mean you'll have high homocysteine, it just increases susceptibility, especially with poor folate intake. Certain underlying health conditions are associated with elevated homocysteine. One of the most challenging aspects of high homocysteine is that it typically does not cause any symptoms on its own. A person can have moderately or even significantly elevated levels for years without feeling any different. This is why it's often called a silent risk factor. You would not know you have it unless you are specifically tested for it. The lack of symptoms is dangerous because the damage to your arteries can be occurring quietly in the background, without any warning signs until a major cardiovascular event happens, like a heart attack or stroke happens. This is the first time many people ever learn they have a problem. In very rare and extreme cases of hyperhomocysteinemia, usually caused by a severe genetic disorder, symptoms can be present from a young age. These are not the mild to moderate elevations we typically see in adults. Symptoms can include developmental delays, vision problems, skeletal abnormalities, and a very high risk of blood clots early in life. However, it's crucial to understand that this clinical picture is vastly different from the elevated levels that are commonly associated with diet and lifestyle in the general adult population. Because most people with high homocysteine have no direct symptoms, we have to look for indirect clues. So, testing for homocysteine is actually a pretty straightforward process. Your doctor can order a simple blood test to measure the concentration of homocysteine in your plasma. To make sure the results are as accurate as possible, you'll usually be asked to fast for about 10 to 12 hours before your blood is drawn. That basically means nothing to eat or drink except for water. Fasting really matters, because the level of homocysteine in your blood can temporarily rise after you eat a protein-rich meal. Protein contains methionine, which can raise homocysteine temporarily. The test itself is just like any other routine blood test, a small sample drawn from a vein in your arm. Once the lab analyzes your blood sample, the results are reported in micromoles per liter. Close-up of a lab report showing a homocysteine test result with the number highlighted. While different labs may have slightly different reference ranges, there are generally accepted guidelines. A normal or optimal homocysteine level is usually considered below 15 micromoles per liter. Many experts think an ideal level is under 10 micromoles per liter for best cardiovascular protection. It's just a number that gives a snapshot of your metabolic state at that moment. Results are grouped into levels of elevation, 15 to 30 micromoles per liter. That's considered mild hyperhomocysteinemia. 30 to 100 micromoles per liter, classified as intermediate. Anything above 100 micromoles per liter is considered severe. For most adults, any elevation is typically mild. If your homocysteine level is high, the good news is there are clear, effective, practical steps to lower it. The main strategy: ensure your body gets enough key B vitamins. Focus on vitamin B12, folate, also known as vitamin B9, and vitamin B6. For many people, improving their diet is enough to bring levels back into the healthy range. But depending on how high your level is and what's causing it, your doctor might recommend supplements for a more direct effect. First step, increase foods rich in these B vitamins. Folate, leafy green veggies, legumes, fortified grains, vitamin B12, fish, meat, poultry, eggs, dairy, vitamin B6, fish, poultry, potatoes, and non-citrus fruits. Making a conscious effort to include a variety of these foods in your daily meals is the foundation of managing homocysteine naturally. We'll explore specific food examples in more detail next. Focusing on your diet is one of the most powerful and delicious ways to support healthy homocysteine levels. The goal here is to give your body the B vitamins it needs so metabolic pathways run smoothly. Let's start with folate. Dark leafy greens, spinach, kale, romaine lettuce, asparagus, Brussels sprouts, legumes, lentils, chickpeas, black beans, fortified foods, breads, cereals, pastas. Next up, vitamin B12. Fish, lean meats, poultry, eggs, dairy, nutritional yeast, plant-based milks, fortified cereals. Third, vitamin B6. Chickpeas, fish, poultry, potatoes, bananas. Example plate: grilled salmon, steamed spinach, quinoa, brown rice, lentil soup, whole grain roll. Breakfast: scrambled eggs, sautéed spinach. The key: variety and consistency. Build meals around nutrient-dense whole foods to support overall health. Knowing when to have a conversation with your doctor about homocysteine is a really important part of being proactive about your health. You should think about bringing it up if you have a strong family history of early cardiovascular disease, a parent, a sibling. You should also mention it if you've already been diagnosed with cardiovascular disease, peripheral artery disease, stroke. In these cases, knowing your homocysteine level can help manage your condition and reduce future risk. If you have medical conditions linked to high homocysteine, have the conversation. Chronic kidney disease, hypothyroidism, lupus, rheumatoid arthritis. If you follow a long-term vegan or vegetarian diet and aren't supplementing with vitamin B12, get your levels checked. Your doctor can assess your risk and decide if testing makes sense. Don't hesitate to ask, should I be concerned about my homocysteine level? Homocysteine is a modifiable risk factor. It's linked to serious heart and vascular problems, but it's a number you can often control. Your body relies on 3 B vitamins to regulate homocysteine: folate, B12, B6. Deficiency in any is the most common cause of high levels. Simple, practical changes can make a big difference. Focus on eating a diet rich in leafy greens, legumes, fish, poultry, eggs. Finally, talk to your doctor. They can determine if you need testing, help interpret results, and create a plan to restore healthy levels. Knowing your number and taking action is a powerful step to protect long-term health.